I am Jen Frost, and I'm the Human Resources Administrative Associate here at Sight and Sound. Oh, a normal day around here, it changes every single day based on the needs of our employees. If one person is gone, we feel it. We feel it, their team feels it, and it can ripple through the entire building. When you're having to stretch other team members, it's not ideal.
My first encounter and first visit there was incredible. It was total commitment to me as a patient. They are able to get results to us very quickly. And I was really impressed that the practitioner at Command was out of the country on the week that I had my blood work, and I received an email from her from another country at 10 o'clock at night giving me my test results and all the information that I needed for those results. So it was just a really impressive and good thing for me as a patient.
You know, when you go to a normal or a traditional healthcare environment, oftentimes you're having to wait a lengthy time, number one, just to get an appointment. And then when you finally do get the appointment, you're spending a lot of time catching that doctor up on what your particular situation is. And this is very personal, and I would call it like a concierge benefit. When you don't feel good, you want a quick solution, and that's something that's been really appreciated by our employees.
A direct primary care physician that you have access to on a daily basis is like finding gold these days. And sometimes they don't even need to see you in office. They just want to talk to you, find out what your symptoms are. Just knowing that you have somebody listening to you who is available and you're not going to have to wait 2 weeks. It's so nice. It's so nice to be able to have that help on the daily. I have texted several times on the weekends because, like I said, I tend to wait 7 days before anything goes wrong. And of course, the 7th day is always on a Saturday at 2 p.m. But the fact that you can still get help in the off hours.
They listen to your story and they start there. And they don't just start with medical tests and a checklist of different things that need to happen, but they listen. And I think that that is the number one most important thing in healthcare today.
Not only do they listen and they care, they say I'm in charge of my own healthcare and that I have options to choose from. So does it need to just wait a few days? Do you want to try natural options? Would you like to try an antibiotic? I get to choose. I don't just get told, this is what we're going to do for your health. And I really appreciate that.
Sometimes costs can be a barrier and people don't want to go to the doctor because they're like, what's this going to cost me? Where there isn't a fee to go and just check out what's wrong, you know, and then the fees that are there are much less than what you would pay in a traditional healthcare environment. And so, yes, our employees they're very, very happy with it.
If you want a healthier team, if you want a team that's going to be on top of it, check out Command. Go meet with people, go talk with people, hear all about it and what they offer, because what you will experience on the backside of having it is going to be so beneficial that you're going to be like, why didn't we do this before?
And I can tell that they're really for the patient. You know, they aren't trying to gouge the patient and make money off of things like labs and medicines. They're trying to just treat the patient with the way that, you know, we need to be treated to be able to become healthy again.